Namaste. This is Dr. Sumita Sengupta, the founder and president of Arts for All Foundation. And today we're going to do a very special Thanksgiving show. And it's a different kind of Thanksgiving show because we're honoring a very special person who's with us. And there's going to be another special person with us, and we'll tell you about that in 1 minute. So I want to talk to you about what is Thanksgiving, the deeper meaning. We all know about the Pilgrims and the first feast that they had with the Native Americans, but Thanksgiving in America has grown into a much deeper celebration. This is the time we feel gratitude, we feel reconciliation, we have compassion, we give back, and we feel hope. This is the time we reflect, and we're happy to be with our family and friends. But as you know, everybody doesn't have the same opportunity. And so this Thanksgiving, we want to be very grateful for all our blessings. And the people here today are going to speak about that. And I'd like to talk about the person who is the chairman of ITV Gold and Parekh Media, Dr. Sudhir Parekh. And we're very thankful that he's with us tonight. And we're very grateful and thankful for this special edition. He has joined us to greet the viewers. And please join me in welcoming Dr. Sudhir Parekh.
Thank you, everyone. Happy Thanksgiving. Dr. Alejandro, welcome to our ITV Gold TV channel, which is the biggest and largest TV channel of South Asian community. Our channel has almost over 30 million viewers of South Asian descent, and also we have 4 weekly newspaper, 3 in English and 1 in regional language of India. And this is it's my other than my medical profession, this is my philanthropic work to the community, because when I turned 60, I said that I had done this thing, that thing, founded the organization. So this organization, doctors organization called API. Also, right now, I'm a president of the Global Physician of Indian Origin Worldwide, which represents 1.4 million Indian doctors worldwide, including USA. So, whole idea behind owning the media is to empower the second generation and beyond, and connect them to Mother India, Indian culture, as well as connect them to their kind of what we call is a karma bhumi, which is USA, because they are born in USA and they're educated in USA and they make their livelihood in USA. So they should be very thankful to USA. We all should be thankful to USA, because what we are today is because of the greatness of the great culture, great heritage, and great richness of the USA background and ability and facilities what we get. And now I would like to specifically thank Hospital for Special Surgery, because I had my own first experience there for surgery, and my surgeon, I'm very lucky today and privileged that my surgeon, Dr. Alejandro Gonzalez Della Valle, joined here with us. Really, thank you, doctor. I had a surgery done 2 months ago, and I'm back to work since last 3 weeks in the office and seeing and taking care of my patients. So I'm really grateful to you and grateful to Hospital for Special Surgery. It's a great hospital, and it is a great hospital worldwide. I mean, for the orthopedic surgery, there is no facility like Hospital for Special Surgery. That's why there are a lot of patients from India comes to even our Prime Minister, previous former Prime Minister Atalji Vajpayee came to a Hospital for Special Surgery in 2002 and had a knee surgery done by Dr. Ranawat, the senior, who just retired now. So hospital for special surgery is well known in Asia as well as in India in particular. So thank you, Dr. Alejandro. Great work. You are a great surgeon, and really I cannot say enough thank you to you for a great surgery done on me and great successful results. So again, I think this is a day where we should thank each other because for good work. Because I like this Thanksgiving holiday because it has there's no religion, is a non-religious, is none kind of any dissent. It's meant for everybody, and it's very happy holidays. So I think let's enjoy the Thanksgiving holiday and thank each other, and whoever helped you in your life, we should thank. So after saying that, let me go back to Sunita and Sumita, and then Sumita, I can continue further.
Thank you, Dr. Parekh. So you've heard about Hospital for Special Surgery. It's world known. It's the #1 hospital in not only in the United States, but probably the entire world. And it's held that ranking for 16 years. It does amazing work for anybody who's had to be a patient there. They, just like Dr. Parekh, they will give accolades to this hospital. So every doctor, every nurse, and every therapist is focused on treating the patient with any musculoskeletal conditions. And what I liked about Hospital for Special Surgery, they don't just treat the body part that you need fixed, they treat the whole you. And their goal is to get you back into your best life. And I think that is a unique focus of HSS. So please welcome Dr. Alejandro Gonzalez Della Valle. Welcome to ITV Gold. And happy Thanksgiving, Doctor.
Sumita, thank you so much. And Sudhir, thank you for your wonderful words. It's a pleasure to be here. And I would like to wish you both and the rest of the audience a wonderful Thanksgiving. I agree with Sudhir. It's a really, really wonderful holiday where we give thanks for everything we have. Sudhir's outcome is not my own responsibility. It's his own too. And I want to highlight that what we do in the hospital is not necessarily my direct responsibility, as I work with a wonderful group of people in the hospital, without whom the results that we see would not be possible. And I'm talking about everybody, from the person who greets you in the lobby to the person who is going to be your nurse, your physical therapist, your social worker that will help you with the discharge planning, our wonderful anesthesiologists, the people that give us a hand and do us a tremendous job helping us with your operation itself. Is not only me. We cannot operate as a single unit. It's typically 5 to 6 people that are doing this wonderful teamwork to make sure that our operations are successful and that are safely done. So thanks again, and I look forward to your questions. And again, happy Thanksgiving to everybody.
So Alejandro, what do you think you've done this for numerous years? What has changed in this field, and what makes HSS cutting edge in particularly knee and hip replacement?
Sumita, so much has changed. I will take you back reflecting on Sudhir's comments about how welcoming to foreigners the United States is. I trained in Argentina. When I was training as a resident, our joint replacement patients would stay in the hospital 5 to 6 days. Nowadays, patients typically go home the same day of the surgery or the next morning, particularly the healthiest ones who have a good support system at home and who are motivated. Let me give another example. Surgical time, when I started, used to be 2 hours. Now it's generally 1 hour. Likelihood of blood transfusion, when I started training, 25%. Now 2 to 3%. The anesthesia was rudimentary. Now both general and epidural anesthesia, which is our preferred form of anesthesia, are so well developed. The likelihood of blood transfusion has dropped substantially, not only because of the way we do the operation. There are drugs that we administer to patients that drastically diminish their blood loss. With less blood loss, the patients feel more energetic, there is less pain, and patients tend to recover a bit faster. Also, major advancements have been made in relation to pain control. Let me give you the example of a patient who has a total knee replacement. He or she was given pain medication, typically in the form of narcotics, for 3, sometimes 4 months, many years ago. Where nowadays, and Sudhir, you may want to share your experience, typically by the 2nd or 3rd week, patients are no longer taking pain medication.
And another interesting thing that I read upon is that in addition to the technological advances, the quality of the materials used, the research done behind what is selected to use, that the Hospital of Special Surgery has built up such a network before the patient even knows what's happening. So can you briefly, elaborate on that?
Sumita, you bring up an excellent point, which is essentially relates to the fact that these prosthetic devices that we implant in the hip and the knee, they are typically made of metal, ceramics, and plastic. Years ago, we used to have serious concerns about the likelihood of that plastic wearing out throughout the life of a patient. And intuitively speaking, the more active they were, the faster they would wear out the polyethylene plastic. And that would generate a number of negative consequences around the bones of the hip or the knee replacements. Now, approximately 25 years ago, orthopedic companies changed the way plastics were being sterilized. And they are being sterilized in a way now that makes them harder and much more wear resistant. And that has completely changed our perception of how long a hip or a knee replacement would last, and also has changed our recommendations to patients. If you allow me to expand, let's say 20 years ago, a young person undergoing a hip replacement, we would advise them not to walk more than a certain amount of miles each day. We would strongly advise them not to perform any activities that involve repetitive pounding, grinding, or impact in the hip or the knee. Whereas now, we allow them to participate in a large number of sports.
Dr. Alejandro, you've been as a surgeon a long time. You've been with HSS a long time. To our viewers, you said, find the right surgeon that you're comfortable with if you need such a treatment. So why HSS for you and for other patients?
Sumita, I cannot answer that question because I'm terribly biased. I love my hospital. I've been fortunate enough to have been selected to become an attending over 20 years ago, and I built my entire career and practice in HSS. And you and Sudhir were discussing how wonderful the experiences that patients have in HSS. And I want to tell the audience that that is 99% human factor. The technical capabilities that the hospital has are enormous, but the outcomes that patients feel are without any question substantially driven by human-to-human interaction and the type of culture that the hospital has. And Sudhir, I hope you were, it was evident when you came to HSS for your care. everybody that interacts with you wants you to do great, and he or she will do their best for you to do great. And that's the type of environment that the hospital has created, and very likely the reason for its success. In that regard, as much as it is a blessing for patients to receive care in HSS, it is for us physicians to be able to practice medicine to the highest possible level in that hospital. I hope that that's a description of how I feel, Sumita and Sudhir.
I agree with Dr. Alejandro, what he said 100%, because I was following HSS for a long time, even the last 25 years since my former Prime Minister had a knee replacement done by Dr. Sindhi Ranawat, who just retired a few years ago. And a lot of my friends work there, particularly in the pathology department and other department. So I know the hospital, and I'm having my personal experience. I'm going to, with all the permission of the Dr. Alejandro as well as the HSS administration, that I'm a president of the Global Physician of Indian Origin for next 3 years, and which is in 57 different countries. So, and a lot of countries, most of medical tourism happens because of the orthopedic surgery, because it's very easy to go to best place, get surgery done, and go back to their home country. And I'm going to invite Dr. Alejandro to our annual function to give the keynote speech about the HSS, because I firmly believe personally that and I'm going to recommend publicly that my personal experience and the greatness of the HSS. So really, today's on the Thanksgiving Day celebration, I would like to thank you, HSS, many thanks, as well as my surgeon, Dr. Alejandro Gonzalez Della Valle. Really, whatever I say is not enough, but I mean, you can feel that emotionally I'm saying that I thank you very much.
Thank you, Dr. Parry. Thank you so much. It's an honor. Those are wonderful words, and I agree with you. On the other hand, the value of a patient who comes with a very positive attitude is enormous. And that positive attitude is a great contributor to the success of the overall procedure and the operation. The same can be said for other elective and non-elective medical procedures that you may want to have in mind. But definitely Sudhir has a wonderful personality, and it has been a pleasure to treat him and to consider him one of my friends now.
Thank you.
Sure.
Thank you, Doctor.
That's wonderful.
And okay, go ahead, Sunita.
No, you first.
No, you just concluded, and then I want to just say a couple of comments and some information, not comment. Yeah.
Okay, so thank you. I knew you had a very busy day, and I knew I was very persistent with the hospital. So we're very honored that you came and you shared with the ITV viewers not only your professional expertise and the hospital's expertise, but that you kind of showed people that, and Dr. Parekh being a testimonial and example, that there's a place to go right here in New York, and you can get done, treated, and get on with your life. So thank you for that wonderful message. It's going to be a blessing to many people. And thank you for all the work that you do tirelessly for all the people that you serve. So we always do, our culture does namaste as a honor. So namaste as a greeting as well. Dr. Parekh.
Thank you all. And anyway, this is a side information that Dr. Alejandro, this interview will be seen by 30 million viewers on the different platform of the cable TVs and Sling and digital TVs, Dish Network, and everywhere. And then after next week, then it will go on the YouTube. And of course, I will send you that YouTube copy to you, so you can forward to all your friends or family or whoever you want to. And we are going to make a front page story about this, whatever you said today in your interview about HSS, about your techniques, about your way of treating the patients, and very special support system in the hospital will go in our print media, and there are, in 4 different weekly newspaper, and it will be read by so many South Asian families. So that's our way of saying thank you to you and celebrating the this Thanksgiving Day. Thank you.
Thank you,
Thank you.
Sudhir and Sumita, and thank you so much for featuring what we do here in the hospital every day. Again, I may be here today in front of all of you. I cannot do my job without the wonderful work of everybody who is doing his or her job in our hospital.
Thank you. Happy Thanksgiving.
Happy Thanksgiving.